Welcome to another explainer. Today, we're undertaking a really fascinating diagnostic journey. Let me ask you this. Have you ever looked at a medical ultrasound and thought it just looked like a blurry black and white static screen? Well, you're definitely not alone. But within all those shades of gray is an incredibly detailed, dynamic map of human health. Today, our goal is to demystify that black and white static, specifically for the human kidneys. By the end of this explainer, you're going to understand how to spot normal kidney health and, more importantly, how to identify common abnormalities using the exact same visual cues the professionals use. But before we look closely at the organ itself, we really need to understand the tool we're using. Renal ultrasonography is honestly remarkable. It's a completely safe, non-invasive, and highly effective imaging tool. It relies entirely on sound waves, high-frequency sound waves that bounce off our internal structures to create a real-time picture. It requires zero radiation, which makes it an incredible, harmless window directly into the human body to evaluate anatomy and detect underlying conditions. Okay, let's dive into this diagnostic journey. Our roadmap today covers 1. The healthy kidney, 2. Stones and obstructions, 3. Cysts and masses, and 4. Chronic kidney disease. As we go through this, I want you to start thinking like a sonographer, always looking from the healthy baseline to spot any deviation. Section 1. The healthy kidney establishing the baseline. You see, to spot disease, we first need to cement what a perfectly healthy kidney actually looks like. You really can't recognize an abnormality until you know the norm. Size is our very first metric. A normal adult kidney measures right around 9 to 12 centimeters in length. I want you to lock that number in your mind because it provides a crucial visual anchor for scale. When a sonographer first places the probe on a patient, verifying that 9 to 12 centimeter length tells them immediately that the organ hasn't swollen up from acute stress or shriveled down from chronic damage. All right, let's break down the visual language of the organ itself. On a healthy ultrasound, the outer layer, the cortex, appears slightly darker than the nearby liver or spleen. In stark contrast, the inner area, which is known as the renal sinus, is very bright. This brightness is just due to the echoes bouncing off the fat and the collecting system inside the sinus. So the absolute crucial point here is that you should see a stark, clean contrast between that dark outer cortex and the bright inner sinus. In the medical world, this is called clear corticomedullary differentiation. That clear visual boundary, that is the ultimate hallmark of a healthy kidney. Moving on to Section 2. Stones and obstructions, the physical blockages. Now we're shifting our focus to see exactly what happens when there are acute physical disruptions to this finely tuned system. Probably the most common physical disruption is the infamous kidney stone, known medically as a renal calculus. On an ultrasound, stones appear as echogenic foci. I know, that's a bit of medical jargon, but essentially, echogenic just means it reflects sound waves very strongly. Because stones are hard, dense objects, the sound waves bounce right off them, making them appear as intense, bright spots on the screen. And because the sound waves can't pass through that dense stone, they leave a dark trail right behind it. We call this clean posterior acoustic shadowing. It literally casts a shadow on the ultrasound image. But what if a stone is incredibly small? It might be really hard to see that bright spot or the shadow. Well, sonographers have a brilliant trick for this. By turning on a feature called color Doppler, small stones will often demonstrate what's known as a twinkling artifact. Instead of a shadow, the ultrasound displays this rapid, alternating splash of color right where the tiny stone is hiding. This vastly improves detection and helps catch stones that might otherwise be completely invisible. And this brilliantly illustrates the chain reaction of what happens when one of those stones gets stuck. Step 1. A urinary obstruction occurs. Because the urine can't drain, step 2 kicks in. The renal collecting system begins to dilate or stretch out as pressure builds up. This leads directly to step 3, a condition called hydronephrosis, which translates to water inside the kidney. Depending on the severity of the swelling, sonographers will actually grade this hydronephrosis on a scale from grade 1 to grade 4. So, to identify this hydronephrosis, we look for something that is anechoic. Unlike our bright stones, anechoic means appearing totally dark or black on the ultrasound screen. You see, sound waves pass right through clear fluids like water or urine without bouncing back at all. So when the renal pelvis and calyces dilate and fill with backed up fluid during hydronephrosis, those areas show up on the screen as large, totally dark, anechoic pools inside the kidney. Now, This isn't just some temporary plumbing issue. It can have real structural consequences. If this blockage and the resulting fluid buildup becomes severe, pushing into those grade 3 and IV categories, the intense internal pressure actually physically compresses the kidney tissue. Over time, this leads to the thinning of the renal cortex. That healthy, dark outer layer we established earlier gets stretched and squeezed, which can seriously compromise the kidney's overall ability to function. Let's transition to Section 3, Cysts and Masses, Structural Anomalies. Here, we're moving away from those plumbing blockages and looking at actual structural growths within the kidney tissue itself. What's absolutely fascinating here is the stark contrast between two very different types of growths. First, we have a simple renal cyst. These are incredibly common, especially in older adults, and they're usually perfectly benign. They appear round or oval, they have a thin, smooth wall, and they are anechoic, meaning they're just filled with simple fluid. But then contrast that with a renal mass. This is a much more complex structure. It can appear solid, heterogeneous, meaning it's mixed in texture, or sometimes cystic. Crucially, if you use color Doppler on a mass, you'll often see internal vascularity, meaning blood is actively flowing inside of it. Because of this complexity, any suspicious renal mass always requires further assessment with a CT or MRI scan for accurate characterization. Let's see how this builds our visual vocabulary even further. Remember how those dense kidney stones cast a dark shadow? Well, simple cysts do the exact opposite. Because a cyst has no internal echoes, since it's just clear fluid, the sound waves travel through it incredibly easily. This causes the area immediately behind the cyst to appear artificially brighter on the ultrasound. We call this posterior acoustic enhancement. It's a fantastic visual clue that confirms you're looking at a harmless pocket of fluid rather than a solid mass. Finally, we arrive at Section 4, Chronic Kidney Disease, Systemic Decline. This requires a slightly different perspective because we're shifting from localized issues like a single stone or a cyst to a systemic, long-term decline of the entire organ. Let's mentally compare a kidney suffering from chronic kidney disease against the healthy baseline we established at the very beginning of this explainer. Remember, our healthy kidney is 9 to 12 centimeters with a dark cortex and clear differentiation. But the presentation of CKD is drastically different. Long-standing renal damage physically shrinks the organ, causing a notably small size. The outer cortex suffers cortical thinning. On top of that, the overall tissue becomes scarred and dense, which leads to increased echogenicity, meaning the whole kidney appears abnormally bright on the screen. Because everything becomes bright and muddy, you get poor cortical medullary differentiation. That beautiful, clear boundary between the dark outside and bright inside, it's completely lost. Let's bring all of this together now. This matrix summarizes everything we've learned, essentially acting as your ultimate translation guide for the visual language of ultrasounds. If you see something bright and echogenic that leaves an acoustic shadowing trail, you're likely looking at a stone. If you see something completely dark and anechoic with a thin, smooth wall, that is a simple fluid-filled cyst. And if the entire kidney is unusually bright, exceptionally small, and has a thin cortex, well, those are the classic signs of chronic kidney disease. You can now officially read the core language of renal ultrasounds. It's truly incredible to think about, isn't it? We've just explored how a completely safe, non-invasive imaging tool can peer right through the skin, bounce high-frequency sound off of internal tissues, and paint a masterfully detailed picture of human anatomy in real time. From the sharp shadow of a tiny stone, to the deep black pools of an obstruction, to the bright, muddy fade of chronic disease, all the clues are right there on the screen. It leaves you wondering, what story are your sound waves telling? Could a simple sound wave save a life today? Thank you so much for joining me on this explainer, and keep looking for the clarity within the static.